So there we start. So Dr. Lebow, again, thank you so much for joining us this afternoon. Really appreciate your time. We'd love if you can give a little bit about background about what you do and then share with us from what you know about the coronavirus to date. What does it look like? What are the symptoms that people should be aware of? How it's manifesting itself, taking into account, obviously, the supreme immune system of cancer patients as they go through their treatment and still need to be as careful as possible from the coronavirus.
Well, thank you. And as you can see, my name's Dr. Max Lebow. And by the way, thank you for the people that shared your experiences. And it's always important to hear about what's going on, perhaps not in my particular area of medicine. So it adds to my knowledge to hear from you. And if there are any questions that we don't get to today, certainly you can send them to me and I'll try to answer anything that I can to the best of my knowledge. I'm trained in emergency medicine and also in preventive medicine. So the COVID is especially significant for me as a clinician in that I treat the acute manifestations of COVID, but I'm also very aware of the public health issues involved with COVID, and I certainly can answer any questions about it. Let me just go through and make sure we all understand with a basic fund of knowledge about COVID. COVID, of course, is passed from one person to the next by respiratory secretions, and they don't go through your hand. They go through your hand touching your mouth if you touch something that might have a COVID virus on it, and we'll talk a little bit about that in a moment. But if you come in contact with a COVID positive patient and you acquire COVID, within about 3.5 to 5 days, you'll become positive for the COVID test, and you will begin to have symptoms. Before you have symptoms, even if you come into contact with a COVID positive person, and we get a lot of patients who come in and ask to be tested on the same day that they get in contact with a COVID patient, and that really, it would still be negative. The test becomes positive about the time when clinical symptoms occur. In most patients who get COVID, including patients that have some immune compromise, although it's more dangerous, still the majority of patients still survive, do well, and don't have a death as an outcome. Most people still survive it. Most people in their 80s still survive. However, the rate of poor outcome increases as we get older, with children hardly ever having a very serious case, about 1 in 1,000 or 0.1% or 0.1%. To an older person, maybe we'll get into 15 or 20%. And if you have pre-existing, maybe even more than that. However, it's not a death sentence, and I don't think we should think of it in that way. Once somebody has a COVID, as I mentioned, most patients will get the symptoms primarily of coughing, usually a dry cough. You don't bring up much mucus, and that's part of the irritating part for a lot of patients. Is you feel like you want to bring up something, but there's nothing there. And also a fever. Many patients get nausea and don't want to eat, but I treat a lot of COVID patients, and making sure that you drink plenty of fluids is a very important part of the COVID virus treatment. And then the things to look out for, and the things that make COVID dangerous, are primarily in its effect on lung function. So If somebody is coughing and fever and feeling nauseated, there still is not a treatment, although there are some promising treatments out there. And if we want to talk about those later, we certainly can. But the most patients are treated at home. However, when should you go to the emergency room? When should you seek further care? And the answer is when there's a compromise in breathing. Generally speaking, if somebody, and if you're taking care of somebody who has a COVID, and many of us are in the role of caretaker, it would be, is the patient able to complete a sentence without taking a breath in the middle? That would be a sign of shortness of breath. Or are they using their entire chest to breathe? Using your entire chest. Generally speaking, your diaphragm, you breathe, and your body doesn't move when you breathe. The more a person moves as they breathe is a sign of shortness of breath. And the things that they talk about blue lips and things like that, those come a little later. It's important to catch it earlier when there's the clues that a patient is having respiratory distress. In other words, breathing is causing distress. If somebody goes to the hospital, that would be a minority of patients. For patients who are staying at home, generally speaking, about 10 to 14 days, it will run its course. Although I've seen some patients who've run their course in 7 days, and I've seen others that take 21 days. But about 2 weeks or so, at that point, then the CDC recommendations it's called a 772 rule. A patient has to be at home once they have COVID, either tested positive or clinically have the disease, because our tests are not that, sometimes miss the disease, and they'll show negative even though we know the patient has COVID. Once you have COVID, then it's a 7-7 rule. You need to be home for 7 days or at a minimum, and you need to be without a fever for 72 hours without taking a Tylenol or a fever reducer. Once that occurs, then the current CDC recommendations are that you have developed an immunity to COVID, and they still ask you to use personal protective equipment such as masks, to not that you will get it again, but that there is a certain number of days that we're not sure. Some people continue to shed the virus even after they've been asymptomatic, that they have no symptoms for 72 hours. So that we still ask them to take a mask, and that's the clinical course of most patients. Get in contact with someone, get sick in 3 to 5 days, have the illness from 10 to 14 days, begin to defervesce or the fever breaks at somewhere around 10 to 14 days, 3 more days of recuperation, and then you are done with COVID. You have experienced COVID. You are now have some immunity built up. We don't know for how long, maybe just till next year. But we think that once you've had COVID once, at least this strain, at least this year, you won't get it again. And I wish they would report this more often. Of the millions of cases that have been reported, it's important to know that about 500,000 have now recovered from COVID, because a lot of people have got it in the last 2 weeks, and the number have risen. There's still probably about equal number of patients with COVID at this point, and an equal number who are now better. And I wish that they would talk more about those who are done with COVID and are now immune and living their life in a post-COVID. So that's sort of the life history of COVID. If there's any other things in particular I can answer.
Yeah, I think it would be great then to tell us a little bit maybe about what would be your recommendation in terms of protecting ourselves, minimizing the exposure, other than just the social distancing, if there's anything else we need to do?
Okay. Yes, I'd love to talk about that. Uh, Certainly, there's a lot of misconceptions, and I want to clear them up right now. Of course, we believe that social distancing, the reason we do social distancing is because COVID is transmitted through droplets. We think there may be some possible transmission in the air in a very concentrated environment, for instance, an emergency department. But in the outside, when somebody was saying, one of our viewers was talking about going for a walk this morning. That's a wonderful idea, and I do the same myself. And so when should you wear a mask or face covering? When you go out for a walk, this is what I do. More people, because gyms are closed and everything is closed, and people generally stay on the sidewalks. I see a lot of people are not wearing masks, and so what I do is I carry a mask. If I get to a busy corner or something like that, I generally wear it around my neck, and I'll slip it over my nose when I'm outside for my walk. When I'm around other people, then I'll always look for ways for a little sidewalk where nobody's walking, and then I go down that one. And actually, I've gone down streets that I never, in my own town, that I never went down before, and it's been an adventure finding. So I've made a little game out of it to try to keep my social distancing. There's other things that, besides staying at home, and there are some, and I know one of the questions I always get is about going to the grocery store. It is one of the functions that we still have to do if we don't have somebody to bring us groceries. And about going to the grocery store, it is a function that many of us have to do at any age, at any time. And there are some tips about that. First of all, it's a recommendation in most states, including where I'm at in California and New York and probably New Jersey, that in buildings you must wear a face mask. And by the way, because I'm a doctor, I have surgical face masks, a bandana, or I know that some people are making them themselves. Those are all perfectly okay in the outside environment, in a non-healthcare environment where the concentration of COVID is generally low. And the way you're going to get it outside is sort of running right into somebody's droplet, or somebody is not coughing into their elbow like they should, and they're not wearing a mask like they should. So you want to wear a mask when you go grocery shopping. There's some tips about when you go in, and first of all, if you should take a wipe with you. An alcohol wipe is the best. A towelette that they sell from dispensers. We have them all over the house here and at the clinic. And make sure you wipe off the cart that you use. If you're not wearing gloves, wipe off the cart. The thing about going shopping is to make sure that you spend as little time in the grocery store as possible. And how you do that is make a list first. Make sure you have a list of what you want to get and go straight to that aisle. A lot of us like to just walk up and down the aisles and see, oh, that's I've got a taste for that. I didn't even know till I saw it, so I'll just grab that. That's not the kind of shopping we can do now. What we want to do is make a list, go straight to what we need to go to the checkout and get out. One of the tips that I heard myself recently was that if you're picking up, say, a box of spaghetti or something like that, don't pick the one that's on the front. Go to the back, or the second or third, or the back of the row, to pick up one that's not been exposed to people going back and forth the whole day. And then when you check out, watch what you're doing. Of course, there's new payment methods that don't require even a card, but if you just swipe a card, think about what you're doing, everything that you've touched when you get home. And what we do, and I think this is a good idea, is once we leave the grocery store, we wipe down all the boxes before we put them in the pantry with the alcohol commercial wipe, antiseptic wipe that they sell. It doesn't have to be anything very special. As long as it contains alcohol, it will generally kill any COVID virus. And of course, mechanically, just wiping it, even with a wet cloth, is better than doing nothing. And that will generally, and then I always wait a couple hours before I go back to that particular box. Once I've brought it home and I've wiped it down, or my wife does, I don't go that much, but what we do is we wipe it down, then leave it, and then we'll go back to it after a few hours. The sunlight, air, will help kill the virus, as well as wiping it down and so forth. And remember to wipe down things like your credit card. And we've made a little game of it. At first, I was like everyone, I was resentful about it, and I didn't want to do all this stuff, and how disruptive to my life. However, I'm a doctor and I treat a lot of patients with COVID, but I'm also trying to make sure that I don't get COVID myself. I'm in a risk group as I'm getting older, and I have to do the same things everyone on this call has to do. So I've seen the world from both sides, and I can really speak to anything about that. So that was a very long-winded answer to a short question. I apologize.
No, I think it was a really good one. We appreciate it. So anyone, I want to open it to additional questions. Guys on the call, please feel free to unmute yourself and ask questions.
Well, I have a question.
Sure.
Because my whole family, my grown daughters, my brother, sister-in-law, not just my husband, is saying I'm not allowed in a grocery store now because I'm on active chemo. And I get it, but that was always my fun day out, because as you said, I could walk up and down for hours, and I can't actually go in, get the list, and go. So is that the right thing? Ban me from the groceries for now?
Well, we didn't go into the grocery store for a long time. I think if the higher your risk, the more you should avoid going to the grocery store. And for people who are at high risk, and we try to avoid them as best we can. If you don't need to go to the grocery store, or if somebody can bring groceries to you, that's certainly much better. But
my husband, I'm sending my
I've
husband
been asked the grocery store question on every question and answer, and I thought I would sort of preempt it. However, it's still an outside event, and I think if we are going to go outside, we talked about going for a walk and things like that. Those are much better ways of getting your exercise. But if you can get somebody to get your groceries for you, that is certainly a much better way of proceeding.
Yeah, my husband does it. He has the Santa wipes. He has the mask. He wipes it down before it goes in the trunk, and then everything he's wearing goes into the wash, and he jumps in the shower, and then it's already wiped, and I'm fresh cleaning the vegetables and fruits, and then we're back to normal.
It sounds like you're doing everything perfectly. I mean, congratulations, you get it. And I think that at least for now, this is the best tact to take. It's the best method to move forward.
Okay.
So
will do. I agree, and I trust me, I'm like you. I miss shopping. Anybody else on the Zoom has any additional question they would like to ask?
We had a question from, it's on Facebook Live. One of our patients asked if you think that the virus will mutate next winter.
Well, we don't, nobody knows that right now. So far it hasn't. So far so far the research is going forward on a vaccine, as it is for many different kinds of treatments, including antiviral treatment. You've heard about the chloroquine, hydrochloroquine, and probably not so much the Z-Pak, but the hydrochloroquine treatment. All of them seem to have a little bit of an impact, and we'll know more, especially about some newer antiviral medications that are just coming out in the last 24 to 48 hours, and I haven't read all the research on them as yet. But vaccine will be the time when there'll be the biggest change. And so far, there hasn't been a mutation. We know from previous episodes that in the 1918 Spanish flu, that it did come back in the winter and then even the next year, and then it seemed to sort of dwindle out. Was that because everybody got immune, which is the same thing as a vaccine? Once you've had the disease, of course, you're immune to get it again. We don't want to have to go through that whole process that they went through in 1918. So the vaccine is the best answer. Now, how do you give vaccine to 300 million people in the US and billions of people worldwide? And some of the newer ideas is to have the vaccine in the form of like a Band-Aid that people can administer themselves. It would be, if the vaccine is a shot or something like that, which the first round may be, then we'll be lining up. Everyone will have to get one, and that will be a long process. How many people can get a vaccine in a day in a city? How many healthcare workers are there available to give them? But over the course of several weeks, we will be able to vaccinate everybody. And I think that's previous viruses have yielded to a vaccine, except for there's a few viruses that have not, but the coronavirus type viruses seem to be able to get a vaccine for them. So I think that will be the answer, and hopefully there will not be a major change in the virus RNA anytime soon.
Thank you for that. We have additional question from our Facebook community. We were asked why people who are receiving radiation are also vulnerable, and also if some of the chemotherapy that you're aware of mimics some of the same side effects of coronavirus. That might be confusing for some patients.
Oh, it's very true. How to differentiate, because the coronavirus, I have many patients who come in with malaise, body aches, which are two of the most common, and I probably should have mentioned body aches as a presenting symptom, because sometimes patients just come in with fatigue and body aches, and then they end up testing positive for COVID. Well, those are pretty general symptoms. That's caused by a lot of things. Yeah, and so the best way to differentiate them, of course, is by testing. And I understand that in certain parts of the country, it's difficult to get a COVID test. That's why we were able to acquire testing, and we got some expertise at it. And now we pretty much could tell, if somebody's going to be positive or negative, just having tested so many people. But the many symptoms can mimic COVID. I think what most everyone gets, almost without exception, is a high fever. And if someone has achy, and we had, in fact, I had a patient who had a flare-up of rheumatoid arthritis, which she was on many of the same medications that are used in chemotherapy and so forth. And it turns out that she was COVID negative, but either because of all the stress and change in lifestyle, you know, this has changed our lifestyle, causes a lot of stress, a lot of people who are on either chemotherapeutic agents or a lot of the or steroids and things like that. A lot of it depends on, as you who have been on them, I think can attest to, is how you live your life, making sure that you keep every day about the same, avoiding a lot of stress in your life. All those things tend to make the underlying problem worse, and that's happened now. So the best way is to talk to your doctor. I can't give you any tips other than high fever and a non-productive cough are sort of the hallmarks of that make COVID a little different than many of the medications. Now, as far as radiation, I don't think that radiation, it depends like where the radiation would be. If it's to the lungs, then it might decrease some lung function, and it doesn't necessarily affect the immune system, say like a chemotherapeutic agent or a corticosteroid would. But depending on where it is and the underlying illness, and most of the time I always tell people when and the younger doctors that ask me, will this drug make somebody worse, or would this drug somebody worse? I generally say, go back to the source. What are they taking the medication for? That will guide you into whether a person is more at risk, more than even really the medication in most cases. So if your radiation for certain illnesses may not make your risk that much higher than someone else, if it's to the lungs or something like that, it may incrementally increase. But I think, you know, as long as we want to avoid getting COVID, of course, and if you do, it still should be, you know, treated and with bed rest, and in most cases, at-home treatment will suffice for most people. For us on this call, if you are on a agent that will decrease your immune system, then the recommendation is to just take extra precautions. And it brings me to a point, and I don't know if I'll be asked this, but I'd like to talk about what will things look like. How will this all end? How will we unwind? And we're beginning to sort of get an idea of how that's going to work. And how it looks like it will work is that as the certain businesses will be reopening, they won't look the same. Restaurants, the waiters will have masks and gloves, and the tables will be far apart. That's an example. What will happen is they'll lift the stay-at-home order for people at the least risk, which will be people, say, below the age of 40 or something like that. I think that people like we are, and I'm in a high-risk group, as I mentioned before, just based on my age, we will probably need to continue our stay-at-home order a little longer, probably through the first phase. So it's not gonna look like things will go back to the way they were in February or something like that. It probably won't be like that. It will probably be in a phased return to normalcy. And we who are at higher risk will still need to take precautions, wear gloves, or wear face coverings when we go back to the outside. We'll have to wait when we go back to interacting and going to restaurants and going out and enjoying life again. We'll probably have to wait until we see what happens after the phase one, and they've termed it phase one of the reopening of the American economy. So that's what, that's, I think, how it's going to look for us, our group. And we should be prepared. When that will be, I don't know. I'm very encouraged that things will start to be reopening pretty soon, by either the beginning of May or the middle of May. We'll see some restaurants opening and things like that. Some stores will start to open. And I think for us at high risk, though, we'll still have to be very aware. At a certain point, new cases will go down to a very low number, and we'll be able to resume pretty much normal, although we'll still need to perhaps avoid going to an area where a lot of people are very tightly packed. Maybe air flight will not be a good idea for people at risk. Now, I can tell you that our clinic goes to LAX airport and checks flight passengers. We take their temperatures and things like that. But, those sort of things may be a little off. So again, I went very long with the answer, but I hope it helps people understand what the future maybe will be looking like. And of course, anybody who predicts the future is on pretty thin ice, but that's what I think how it's going to roll out.
No, I think it was a very good explanation. There's 2 questions on the group chat. One regarding immunotherapy. There's some sort of misconception because the immunotherapy is boosting the immune system. It's an extra protection against the virus. So is it true or false?
I don't know the answer to that question. I think that I don't think that we have enough experience with the virus. There are things that boost the immune system. However, it's such a fine balancing act, because the virus gets into the cells. That's how viruses work. They go through the cell wall. They hijack the machinery of a cell, and then if somebody has a lower immunity, it may make it easier for the viruses to get into cells before they're being detected. However, the next step is the body recognizes the virus. It says, because when a virus enters a cell, what it does is it leaves little markers on where it entered the cell. It leaves little pieces of its own covering on the covering of the cell. What it does is it comes up to, and I'm trying to make this as non-technical as possible. If this is a normal cell and this is a virus, it comes in, it'll sort of join your normal cell and go inside. But as it goes inside, it leaves some of its own markers on the outside of the cell. If your immune system is low, that process may continue a little longer before the body recognizes it. Now, if your immune system is high, what happens is, and what has happened to a lot of people who've gotten very sick, is that the immune system says, now there are cells within the body that we need to get rid of. And for some reason, the immune system and this happens more in older people than in younger people, the immune system then attacks those cells. But how does our immune system kill a virus, a cell that's been infected by virus? Well, it goes in and it releases toxic chemicals to kill that cell. What happens though is there's some collateral damage around the cell, so that not only is it the cell that was infected destroyed, but all the cells around it are also destroyed. If your immune system is, and one of the reasons that some older people have been very sick is because our immune system somehow really goes into hyperdrive when it recognizes these cells, these infected cells with the virus in them, and really attacks them vigorously. And when it attacks them vigorously, it causes maybe just not the surrounding collateral damage, but maybe more, a larger circle of collateral damage. And this is what has been one of the big problems in ICUs when people's lungs, they talk about filling up with fluids. Well, that's one of the things, you know, one of the things that the body does whenever, if you notice, if you hit your knee on something, even if it's not a hematoma or something, there's a little bit of swelling right away. One of the defenses the body uses for just about any insult to it is to put more fluid in that area. It's our way of defending ourselves from a lot of bad stuff, and usually it's the right thing. But what happens is, remember, the immune system is attacking those virus infected cells, causing collateral damage, putting poisons in to kill that cell, and also directing the body to put a little fluid in this area. But what happens is too much fluid builds up in the body from that immune system reaction. So now we have to figure out a balance. If somebody's immune system is low, they'll have more infected cells, but maybe their immune system response won't be as strong, and maybe they won't get into that particular problem. However, the virus itself may attack so many cells that decreases lung function. If your immune system is hyper, it may be able to attack those cells earlier, but maybe it'll be too strong, and it will cause a overproduction of fluid and poisons that are used to kill the cell, and that will itself cause problems. Now, I hope I made that as simple as I could. So it's a balance of, can we say that somebody whose immune system is on hyperdrive will do better than someone who isn't? I don't think we can say that yet. I don't think we have enough evidence to say one way or the other. And right now, all the cases are being looked at. I mean, most of our knowledge up until 2 weeks ago was from Wuhan. I don't know if we can trust what comes out of there or not, you know, what over large percentages of large numbers of patients. But we're gathering that information, and each day more information is coming in to answer those questions. I think right now it sort of makes sense that a hyperimmune system somebody who's on hyperdrive might do better, but then they might not. It depends on so many factors that I wouldn't want to make a guess. But in the meantime, I hope I've given everybody sort of a little education on how our body reacts to COVID.
Absolutely. I think it was a really good one. As you can see on your screen, there's 2 additional questions on the chat. One is relating to the mask. Should I wear them while I'm in the treatment center? I mean, she wear them until everybody leaves and she's alone in the infusion center, but since the docs and the nurses continue to wear them, should it be considered an unsafe space even if you're by yourself in the infusion center?
I would wear your mask in the infusion center. I know that it's troublesome sometimes, and I will tell you, when I'm on, sometimes I get a headache from them. I really do. You're breathing, and I don't like them at all. One of the reasons I didn't become a surgeon is because I didn't like to wear a mask, so I get it. I think though we insist on all our staff wearing masks. If somebody's at very low risk, we don't always insist that they wear masks. Many of our patients bring in their own masks. Certainly if we have any doubt about what's going on, we ask them to wear a mask. I mean, the COVID has not been curative for people who cut themselves at 7 o'clock in the evening. Every evening, there's always somebody who comes to the clinic because they were drying dishes and the cup broke that they were drying and got a cut from a glass, and they'll be at low risk, and sometimes they may come in and we try to keep our clinic very, very clean. Many of them come in with a mask. The recommendations at this time are that if you're in a healthcare facility, though, you should wear a mask for now. That may change, even if nobody's in the room, but I don't think we know enough about how long it sort of hangs in the air around us, and it might be for 20 minutes, and it might be for 2 hours. So it's probably not 4 hours, but it's probably not 10 minutes either. So that's another long answer. But my recommendations were for now to wear them.
Okay, thank you. Another question is regarding the anti-malarial drugs that you've mentioned before. If you can tell the role of this drug and whether it's a good idea to use it as a prophylaxis. I mean, you touched it a little briefly before, but maybe you can shed more light about it.
It's not being recommended as a prophylaxis. I just read in my emergency medicine newsletter treatment for hydrochloroquine overdose, since we're seeing those now. So nothing comes without every bad thing has a good side, and every good thing has a bad side. So but right now it's not being recommended for hydrochloroquine. It is being used on patients who are in the ICU, certainly, and for hospitalized patients. I would talk to your doctor and ask them, should I have hydrochloroquine to take at the first sign? And I wouldn't take it for any reason other than if you really think you have some symptoms, because then you end up being on hydrochloroquine all the time. You should, and I would talk to your doctor. Your individual doctor it's not a recommendation at this time that people have it available to start if you do have symptoms. However, I would talk to my doctor and ask him, do you think I should have hydrochloroquine? And of course, when people talk about hydrochloroquine, they also talk about azithromycin, and this azithromycin, which is Z-Pak, has not had as much. It doesn't look like that's going to turn out to be anything. But the hydrochloroquine it's certainly being used on patients who are in hospitals who are using it now. I would talk to your doctor and see how they feel about it. I think that, having maybe a prescription ready to be filled, or have one filled and ready to take, maybe that's the right thing to do if somebody is at risk. But it seems to be at least minimally effective. There's just news out today that there may be an effective antiviral medication for seasonal flu, or for flu A and flu B, which is what we get the flu shots for every year. We do have a medication for that, and we generally will treat people either in the first 48 hours or when they're at risk for the antiviral medication, and it doesn't. It's not like an antibiotic where it kills the germs and you might be better in 48 hours, once you start antibiotic. However, it does seem to reduce the severity of the flu, and and there may be an agent that is doing similar things to COVID. And if that's the case, that would be very good news. That would reduce the severity of the disease, and certainly that's what we get into. It's not the mild disease that is troublesome. It is when it really starts to get out of control. And if we can intervene early and keep that from happening, if we can treat people before they get to the hospital and prevent the hospitalization, then that is the key to really impacting what happens. And it might, we talked about when a vaccine will change a lot. If there's an effective treatment, that will change a lot too. So it's very encouraging that, especially this new antiviral agent, and I'm blocking on the name right now, that may be helpful.
One last question before we wrap up is, and you just talked a little bit about the vaccine. So there is a question here, whether radiation therapy, and I think it's true for other treatment, or chemotherapy or immunotherapy, will prevent patient, do you think, of getting the vaccine?
The vaccine. I don't, certainly not. I wouldn't see why radiation would affect it at all. I think that it would apply the same for a flu shot, and I don't know. I'm not an oncologist. And so I couldn't give exact advice. If your oncologist has suggested that you don't take the flu shot, then you probably shouldn't take the COVID shot. However, because it's more severe, it might be worth any risk to take the COVID vaccine when it comes out. However, most people can take the vaccines without much difficulty, including people, everything from kidney disease to cancer to, and most forms of cancer, to everybody else. And the vaccine, remember, the vaccine is not a live virus. What vaccines are they help the body form antibodies to the virus by taking pieces of the skin around the virus. The virus is encapsulated in a little packet, and most vaccines attack that little skin. And what the vaccine does is it gives you immunity to the sequence of proteins and everything that is, and acids and other chemicals that are on the skin of the virus, so that if a virus would dare get in your body would know right away to stop it, and it would get, instead of going through, there's several kinds of immunity. We talked about the immunity where the body goes in and releases harsh chemicals to kill the cell, but there's another kind of immunity that is much less toxic, which is when the body recognizes the germ before it enters the cell. Remember, we talked about the body attacking the infected cell that has virus in it. Well, what if we were able to attack the virus before it entered the cell? Well, that's the idea of how a vaccine works. It helps your body attack the vaccine as soon as it enters your body, because it recognizes the covering on the vaccine. So I wouldn't think that there's any reason why anybody couldn't take it, but you know, if there's somebody, if an oncologist has suggested you don't take the seasonal flu, he would probably have an opinion about that too.
No, thank you for that. I think it's a good answer, and hopefully sooner than later we can have those discussions, because the vaccine will come out. That's the hope. I really, really want to thank you for your time today, Dr. Lebow. Really appreciate your time and your thoughtful answer. I think it was greatly appreciated by the team online. I really appreciate everybody who joined us this afternoon. And really, if anyone has any additional question or want anything else, send it to us, and we'll send it to Dr. Lebow, and we'll let you know. And again, stay healthy. That's the most important thing. Bye,
advice.
Everybody.
Thank you.
Thank you.
Bye-bye.
Stay well. Bye.
Thank you, Dr. Lebow.
Stay well.
Thank
Stay
you.
well, everyone. Bye-bye.